To Go segment is made possible by Spectrum Health Medical Group.
Colorectal cancer is the third leading cause of cancer-related deaths in the United States. Thankfully, the disease is not only highly treatable, but also highly preventable. Regular screenings can reduce colorectal cancer risk by up to 90%. Spectrum Health has been a leader for advocating for colorectal cancer awareness and regular screening, and is proud to host the 35th annual Irish Jig 5K race on St. Patrick's Day, which is March 17th. To promote colorectal cancer awareness, Dr. Ben Keefe and Kelsey Haynes, Irish Jig race director with Spectrum Health, are here to tell us more. Good morning, you guys.
Good morning.
Okay, so before we talk about the race, tell us a little bit, what exactly is colorectal cancer?
Colorectal cancer is a cancer that starts basically from cells in the lining of the colon.
Okay.
And typically grows into what we call a polyp, which is a mushroom-like growth. And then these polyps over time, over a period of about 7 to 10 years, have the potential for some people to turn into cancer.
Okay. And that's a thing, I mean, like we can see in the video, you kind of can start to see the polyp, and that's what, when you get a colonoscopy done, that's, if there's polyps, they go in with a surgery and remove those, correct?
Correct. And this procedure you're watching here is a polypectomy, removal of a polyp, and this is painless for the patient. And we use a little bit of cautery to essentially burn that off so it doesn't bleed. The patient does not feel that. Patients are asleep during their colonoscopy, so they're comfortable.
Yes, okay, that's what we like to hear. Now, as far as risk factors for, colon cancer, what are some risk factors we're looking at here?
Well, the biggest risk factors, unfortunately, are two things that we can't change, mainly our age and then the genetics that we inherit from our family, our parents. And that's one of the biggest difficulties in getting people motivated to pursue colorectal cancer screening, is that people say, well, I don't have any risk factors, I eat healthy, I'm not overweight, I don't smoke, and I have no family history. The majority of patients that get colorectal cancer, unfortunately, have no family history. So it really can affect everybody, particularly those 50 and older.
Okay, and you kind of talk about, since it takes a while for these polyps to kind of develop, you don't necessarily see symptoms right away, but what are some of the symptoms of colorectal cancer?
Well, symptoms, as you mentioned, symptoms unfortunately tend to develop later in the stage of the disease.
Okay.
So, for instance, a polyp like what we just saw on the screen, that would have no symptoms. But the symptoms we typically worry about would be change in bowel habits that are associated with rectal bleeding, blood in the stool, and then also sometimes unexplained weight loss or abdominal pain.
Now, obviously, a big thing that we talk about is getting screenings done, getting your colonoscopy. Now, when really should that start happening?
So for the general average risk individual, meaning they have no family history in their any first degree relatives, mom, dad, brother, sister, average person we start at age 50. African American population, there's data that shows that they're at higher risk, so we should start in African Americans actually at age 45. And then if you have a family history, meaning a mom, dad, brother, or sister that's had colon cancer, you want to start actually at age 40 or 10 years younger than your family member was diagnosed.
Okay, important to get that done. And the Irish Jig, I mean, the whole purpose is to raise awareness. Tell us a little bit about this year's event happening on St. Patrick's Day.
Yeah, so March is Colorectal Cancer Awareness Month. One of the reasons that we have the Jig on this year. Luckily, we're right on St. Patrick's Day.
Yes, that's awesome.
Day,
I love
so
it.
It's kind of fun. Again, we encourage costume contests, so we have a costume contest every year. And the winner receives a race entry the following year. So it's kind of a fun opportunity. We've got a lot of new features this year. We're going to do a Healthy Living Expo. So at Packet Pickup both Friday and Saturday, we'll have multiple booths there. We'll have our Da Vinci robot so you can actually practice your surgical skills.
Oh, very cool.
Which will be fun. Yoga. We'll have our sports med team there showing different stretches. So a lot of interactive booths, kind of making it very family friendly, educational but fun at the same time event.
Wonderful.
So,
sounds fun.
Yeah.
And when do you have to register by?
Yes, you have to register. Truthfully, you can register up till 5 minutes before the race.
Great.
So it's great. But we encourage people to register by the 27th if you want to be guaranteed your t-shirt size.
Okay. More information about the Irish Jig and Spectrum Health, visit the link we've put on our website at wzzm13.com under the exchange. Thanks for watching.